Hello. Welcome to BruxApp, find out your bruxism. BruxApp Cloud is the most complete tool designed and used by leading experts in the field. It has a solid scientific foundation and is recognized as a medical device. Today, it is the most authoritative application to allow you to find out about and properly manage bruxism when awake. Bruxism is a complex phenomenon, which depends on many factors. It is a voluntary neuromuscular activity, but one that is often unconscious and outside of your control. BruxApp helps you to become aware, a fundamental step in learning how to manage bruxism. The app encourages you to focus your attention on the area of the mouth corresponding to the teeth, the temporomandibular joints, which open and close the mouth, the chewing muscles, which are located in the cheeks and allow you to chew and move the jaw, and, more generally, in terms of the facial muscles. By getting to know your muscle tensions, you can activate the right correction tools thanks to the help of experienced doctors and, finally, manage bruxism. But for BruxApp to be really useful, we need your collaboration.
Now let's explain how it works. BruxApp's main tool is the alert, a sound alert issued by your smartphone in the form of a notification. This is the time to become aware of your muscle tensions. When you hear the alert, you must bring your attention to your mouth and face by asking yourself 3 questions. 1. What position are my teeth in? 2. Are my facial muscles tense or relaxed? 3. Do I have pain in any area of my face? Save your condition and open the notification within 5 minutes of the alert. A screen will appear where you can type the keys corresponding to your status. You can choose between different attitudes, which are all very useful to understand important aspects of your behavior. Don't worry, we'll explain them one by one. Let's start with the 5 main conditions. 1. Relaxed jaw muscles and teeth not in contact. In this condition, the teeth do not touch and the chewing muscles and face are relaxed. The jaw is relaxed and there is no tension in the jaws or face. 2. Clenching of the jaw without contact between the teeth. The teeth do not touch, but the jaw muscles are tense and the jaw is in a fixed and rigid position. Identifying this condition can be difficult. You need to focus on how you perceive the muscles under your skin, their state of tension or contraction. We remind you that these are voluntary, but unconscious, tensions that are likely to be perceived as normal, making muscle tightness habitual. To better recognize the condition of clenching the jaw without contact between the teeth, watch this video by our physiotherapist.
In this short video, we are going to look together at how to recognize mandibular bracing, a condition in which the superior and inferior teeth are not in contact, there is a small space between them, but the tension of the muscles of the jaw keeps the mandible in a fixed and rigid position. Let's now see with Maria Giulia how to recognize these muscular tensions, which are important for awake bruxism. Now, Maria Giulia, pull your teeth apart slightly. Bring your fingers sideways to your chin and try to close your mouth, but your fingers will prevent this, and you must not touch the teeth to each other. Hold this push for a few seconds and feel, observe, recognize the tension that is generated in the jaw muscles, and perhaps help yourself by closing your eyes to perceive better. And relax. Now, always with the teeth slightly apart, bring your fingers sideways to your chin and try to open your mouth more, but your fingers will prevent this. Hold this push for a few seconds and feel, observe, recognize the tensions that are generated in the muscles of the jaw and the temple. And relax.
3. Teeth in contact in a fixed position. Teeth touch each other slightly. This condition can affect all the teeth, as well as a single tooth. 4. Clenching of the teeth with strong contact in a fixed position. Teeth touch each other strongly. This condition can also affect all the teeth or just one tooth. 5. Grinding the teeth. The teeth rub against each other with sliding movements. These movements can occur in any direction and with different intensities of muscle strength. Through BruxApp, you can also report 5 additional relevant conditions. If your tongue is pressed against your teeth. If you place your tongue between your teeth. If you are biting your cheeks, lips, or tongue. If you are holding objects between your teeth, for example, if you are biting or chewing your nails. If you're chewing a piece of chewing gum.
If, when the alert arrives, you are experiencing pain in one or more parts of your face, you can report it through BruxApp. Here is how. After typing your condition, if you have no pain, press Save to save the data. If you have pain in any area of your face, press the button that is marked Pain. A screen will appear where you can swipe right or left to identify the area in which you feel pain. By tapping on the precise point, you can choose the intensity of your pain at that moment on a scale of 1 to 10. 1 corresponds to a very slight pain, while 10 corresponds to a very serious pain, the worst you have ever experienced. Once done, you can return to the face screen with the pain areas. If you feel pain elsewhere on your face, you can click on other areas of pain by entering the intensity for each. At the end, always remember to press Save to save all the data.
Once you have finished this video, you can set up BruxApp. For alerts, choose the ringtone you prefer. Check that it is distinguishable from all other ringtones on your smartphone. Remember that the volume of ringtones also has a separate adjustment from the general volume. Set a volume that is not too low so that you hear alerts every time. Choose the time slot in which to receive the alerts that best suits your habits. If your job doesn't allow you to use your smartphone, choose a time slot outside of your work hours, or ignore alerts while you work. Remember that you cannot change the time slot once the test has started. For your own safety, never use BruxApp while driving or during hazardous activities. BruxApp will send you 20 alerts a day. To get enough data, you need to respond to at least 12 alerts a day for 7 days. If you do not reach 12 daily alerts, don't worry, the test will continue for several days until you have 7 days with at least 12 responses per day. Anyway, after 140 notifications have been answered, the test will be stopped. If you can't use your smartphone right away, memorize your condition and respond to the alert within 5 minutes. After 5 minutes without a response, the alert will be considered ignored. If you're talking or eating, do not respond to the alert, because these are functional conditions. At the end of the test, BruxApp will stop. At this point you can check the results. We remind you that BruxApp gives a preliminary assessment of your bruxism. The definitive diagnosis is up to the doctor alone. If the test detects the presence of bruxism, through BruxApp you can get in touch with a network of experienced dentists and physiotherapists in the area. Starting from the data collected with BruxApp, and through remote medical consultations and in-person appointments, our professionals will help you to diagnose and manage the problem. Now you can get started. For any need or clarification, please contact our technical assistance service at contact@bruxapp.info or visit www.bruxapp.info. Thank you for your attention.